Our community health workers are truly the eyes and ears in our community for health. They form an integral part of our health system. They have actually been trained in, for example, picking up hypertensives, testing for diabetes, doing health education, improving health literacy in their area, and detecting persons who are ill, and as well following up with that. Community health relies a lot on the support and the technical assistance from our international partners, and UNICEF is one of those partners in strengthening the efforts on the ground. They are partnering with us in building the capacity of these community health workers.
I am the only one work in this community, and my community have 250 households and it's over a 1,000 population. So I get up 5 o'clock. I prepare breakfast, and then I prepare myself to go and do my home visit. Every month I have to do 20 home visits to help people, to help other ladies, or to help children. Especially in school, I like to go and do the health education with them. It is important to be a health worker, even though it's a hard time sometimes. I find they come like anytime, but I'm ready to go with them and see what is really happening to them. Many children having high fever and then diarrhea. So they have to leave this village here because it's far. And then sometimes it's raining, sometimes the road is very bad. And then not everybody in our village have transportation.
UNICEF supported the government to undertake functionality assessment using the Community Health Worker Assessment and Improvement Matrix, which is a tool for optimizing community health worker program. Some of the areas identified to be strengthened following the assessment are currently being supported by UNICEF with funding from the Republic of Korea. These include review of the Community Health Worker Manual and development of job aids and counseling cards to enhance the training and capacity of community health workers to provide relevant primary care services. UNICEF is supporting with evidence generation and knowledge management the critical role community health workers in Belize are playing in achieving universal health coverage.
I was interested to help my community and to educate my community with the disease that we are suffering. 11 years ago, I faced a very terrible problem. I have a son that died from 15 years. He was in food farm. He suffered with dengue. That's why I tell myself when I hear that they need a community health worker in my village, I went to the alcalde and talked about this, that I was interested.
She helped the people, and sometimes they help the teachers, sometimes they help BDF. I feel very proud of her because my wife, she worked very hard, especially like now it's very floody and it's muddy. My wife, she's tried her best.
Well, one of the things that we did recently in terms of community health workers, we have increased the salary payment for community health workers, which were $100 to $500. That is for us to ensure that we continue to have enough health workers in our communities. Currently, we have 300 active community health workers across the country. And as part of our budget allocation every year, we ensure that at the ministry level, there's adequate funding assigned through the health education unit in the ministry. And myself as a minister, we take our community health workers very seriously. And we appreciate the work that they have done throughout this country. In fact, they are at the front line for any issues that related to any health matters within their community. So we give them kudos and we thank them for their service.